So you want to know how high blood pressure can affect you? Well, in this video, you'll learn all about how high blood pressure can affect you. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your healthcare needs. By the way, if this is your first time to the channel and you like to get fact-based healthcare tips, then go ahead and subscribe below. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this subject are in the description below. So let's get into the business of high blood pressure and sort fact from fiction. The blood pressure is the pressure at which the blood circulates around in the vessels, and the measurement is commonly associated with two numbers, the top number being the systolic or the pressure at which the heart contracts, and the lower number is the diastolic pressure or pressure between beats. An average normal pressure is about 120/80. The blood pressure can vary somewhat between readings and throughout the day and night, so several measurements should be taken throughout the day for a baseline, preferably with the same device and the same cuff. The cuff is the piece you wrap around your arm. Both numbers are important, and all adults should get their blood pressure checked because persistent high blood pressure or hypertension can lead to serious medical consequences. Knowing your blood pressure is very important, and it's a very simple procedure. Everybody should have their own device and take their own pressure measurements and know what their blood pressure is. So these pressure devices are real easy to use and easy to buy online. So the most important thing is that you get the right cuff size to fit your arm. Cuff size is important as too big a cuff can give you a lower pressure reading and too small a cuff can give you a higher pressure reading. Cuff size should cover about 80% of the distance from the elbow to the shoulder. Now the actual bladder within the cuff that inflates during pressure measurements should cover at least 40% of the inner arm close to the brachial artery. The cuff should be applied snug, but not too tight, not too loose, and the arm should rest comfortably on the desk, roughly at the level of the heart. So when first testing your blood pressure, check the pressure in both arms, as rarely there's a significant difference between the arms, and this will need evaluation. If it's similar, then the right arm is preferred for measurement of the blood pressure. Now don't eat or drink 30 minutes before taking your blood pressure, or exercise or take medicines before measuring your blood pressure. So normal blood pressure for an adult is about 120/80, and anything consistently over about 130/80 is considered to be high blood pressure or hypertension. Most adults have primary hypertension, and only a few have secondary hypertension where there's an underlying medical condition responsible for the high blood pressure. So what are the causes of hypertension or raised blood pressure? So hypertension is due to a constriction or narrowing of smaller blood vessels that increases resistance to blood flow, increases the workload of the heart, and then decreases blood flow to organs and damages them. Most causes of hypertension are labeled essential or primary and invariably due to family history and lifestyle choices, most of them due to an unhealthy diet, smoking, drinking, and a lack of exercise. An unhealthy diet inevitably leads to obesity, and one of the complications of obesity, such as sleep apnea. Also, blood pressure is common in certain families, and certain medications like the pill can cause high blood pressure. As well, there are certain kidney diseases such as renal artery stenosis and certain metabolic and endocrine disorders that can also raise the blood pressure or cause hypertension. Is high blood pressure or hypertension associated with any symptoms? So high blood pressure can cause headaches, nosebleeds, chest pain, blurred vision, dizziness, anxiety, and a number of other non-specific complaints. Of course, if you have any of these symptoms, you should seek immediate professional medical advice. However, most people with raised blood pressure or hypertension are without any symptoms at all, and that is why blood pressure screening is so important. So how can high blood pressure affect me, and what are the complications of persistent hypertension? So high blood pressure or hypertension can lead to serious potential complications, including sudden death. That's why hypertension is often called the silent killer. Hypertension causes vascular disease and peripheral vascular disease, as well as aneurysms, heart attack, heart failure, kidney failure, stroke, dementia, vision loss, and many other issues. Virtually all of these major medical problems can be prevented by diagnosing high blood pressure and getting it under control. So you've checked your blood pressure a number of times and find that it's consistently elevated. What can you do to try and get this under control? There are a number of self-care things that you can do to lower your blood pressure. Adopt a healthy diet with low salt intake, maintain a healthy body weight, limit alcohol, and stop smoking. Get regular, moderate amounts of exercise and get adequate amounts of sleep and reduce stress. By far, losing weight is the most important item you can address. You should also continue to monitor your blood pressure, and if it remains consistently over 130/80, seek professional medical advice to get it down. So if you can't get your blood pressure under control, it's likely that you will need one or more medications, so you should seek professional medical advice. There are many medications available to treat blood pressure, and it may take a little bit of trial and error before one or more of these medications can provide adequate control without any side effects. It's also important to realize that many of these medications do have side effects, and you can check on their potential complications online. Some of these side effects can be a little strange, like a persistent cough or ankle swelling, so it's important to do your homework and check up on these medications that you are prescribed. Also, many physicians will grab samples of these drugs that have been given to them by drug salesmen, and because these samples are unlikely to be generic, they could be very costly. So it's important to start with generic blood pressure medications if you want to keep costs down. It's also important to realize that once your blood pressure is normal, it doesn't mean you can come off the medications. So let's recap. In this video, how can high blood pressure affect me? You learned that high blood pressure is easily checked, it's extremely common, and it's commonly silent, but has potentially devastating consequences. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.